All right. We're going to be testing manual muscle testing for hip flexion. Having your patient seated in short sitting, we're going to be testing hip flexion of the iliopsoas muscle. The origin of the muscle is the iliac fossa, and anterior lateral aspect of T12 through L5 inserts on the lesser trochanter. The iliac portion is the femoral nerve, and the psoas portion is L2 and 3. To test this, first ask your patient to just please bring your knee towards the ceiling, and that would be a grade 3. Okay. Now for grade 4, just come down slightly. Add moderate resistance. Don't let me move you. Okay. Now for grade 5, we're going to do maximum resistance. Don't let me move you. Ready? You could use the table for support to stabilize yourself. Okay, that's a grade 5. If a patient fails 3, 4, and 5, we're going to grade 2, which is going to be sidelining. Please lay on your side, sir. The lowermost limb is going to be in flex position as it is right now for stabilization. And the uppermost limb is going to be tested. You'd want to grab right under the knee and support, and you want to be palpating at the iliopsoas muscle to make sure there's any contractility. Please try and bring your knee towards your nose, sir. This knee, sir. Yep. Okay, good. He's definitely more than 2. And then if he fails a 2, we're going to 1 for trace. Lay on your back, sir. Okay, I'll get on this side so you get a better view. Again, we're going to be under the kneecap, and we're going to be palpating at the iliopsoas muscle for a trace of a muscle contraction. Okay, right there. Wonderful, thank you. And 0 would be no activity due to paralysis. Thank you. Our next MMT video, we're going to be testing hip flexion, again with abduction and external rotation of the knee. That's the sartorius muscle. Origin is the anterior superior iliac spine, inserts on the proximal medial aspect of the tibia, and that's the femoral nerve. What you would like to do, the patient is going to be sitting, and for the sartorius test, first we'd like to demonstrate to make sure we get the proper motion. So you're going to just try and slide up your knee like so. Yep, your heel up here, perfect. You're going to want one hand right here at the distal aspect of the femur for counter pressure, and then one on like the distal aspect of the tibia around the malleoli for resistance. So first, again, just bring it up. Good, that's a 3. And now again, we're going to come up slightly like this, counter pressure here, resistance here, and you're going to like pull down and towards yourself. That's 4, 4 for moderate resistance. Now don't let me move you. 5 maximum. Good. All right, that's 3, 4, and 5. If the patient fails that, we're going into supine. Please lay on your back, sir. As they lay down on their back, we're going to try and do the same thing, but this is with gravity eliminated. So you're going to have your heel on like this, and you're going to ask the patient to try and move their heel up their body, and you could support under the knee if they need, and palpation at the sartorius, which is about here at the ASIS origin. Try and move your heel up your leg. Good. And then if they fail 2, we're going to a 1 for a trace, and that's going to be limb supported. Limb supported, it's going to go around like this, and there'll be just a trace of a muscle contraction. And 0 would be no contraction due to paralysis. Thank you. For our next MMT video, we're going to be doing hip extension. The following four muscles are gluteus maximus. The origin is the posterior sacrum and ilium, inserts on the posterior femur distal to greater trochanter in the iliotibial band. The nerve is the inferior gluteal nerve. Next, we have the semimembranosus muscle. Origin is the ischiotuberosity, posterior surface of medial condyle of tibia, sciatic nerve, tibial division for the nerve. Semitendinosus, also origin on the ischiotuberosity, inserts on the anteromedial surface of the proximal tibia, inserts on, nerve is the sciatic nerve, tibial division, and lastly, we have the bicep femoris. It's only the long head. Inserts also, origin is also on the ischiotuberosity, inserts on the fibular head. The long head does hip extension and knee flexion, as compared to short head, which is just knee flexion. And the long head is the sciatic nerve, tibial division as well. So your patient is going to be prone, laying on their stomach. We're going to be testing the following four muscles. And first, for grade 3, you just want them to try and raise their leg straight up. So keep your knee extended. Just bring your leg straight up. Just so. Keep this leg down. You want to make sure that the pelvis is level. All right. So for grade 4, you could add resistance at more distally at the ankle. Okay. Or for a true grade 4, you would put pressure just distally or proximally around the knee area. Due to level lever arms, the pressure would be less at the knee. So first we'll do at the knee. Okay, ready? Don't let me move you. Okay, that's really good. So now we could go to a 5 and we'll go distally. Ready? Don't let me move you. Okay, that's good. Relax. That was for grade 3, 4, and 5. If a patient wavers at 5 at the distal lever arm, we would go to a 4 right away for a more shorter lever arm. Now, if the patient fails the following, we're going to go straight into 2 and 1 and 0. For a 2, we're going to go side lying. So, sir, would you please lay on your side? Okay, so the lowermost limb is going to be flexed for stabilization. You're going to stabilize at the pelvis to try and keep it neutral. You could, you're going to go under the uppermost limb. You're going to hold it like so, and then palpate at the glute max and the ischiotuberosity for the hamstring contractility. Try and bring your leg back towards me, this one right here. Good, relax. That's for a grade 2. For a grade 1, lay on your stomach, please, sir. For a grade 1, we're just palpating for any contractility of the muscle at the ischiotuberosity of any of the hamstrings or the glute max. For a grade 0, there would be no contractility due to paralysis. Thank you. Our next MMT video, we're going to be doing hip extension with isolation of the glute max. Okay? So you're going to bring your patient's knee to 90 degrees who's laying it prone. Now, please just raise this leg off like so. Wonderful. Relax. That's for a grade 3. Now for a grade 4, we're going to add moderate resistance, just proximal to the cuboidal fossa or the distal femur. So bring your leg up. All right, don't let me move you. Okay, now grade 5, ready? Don't let me move you. Wonderful, relax. That's good. Now that's for 3, 4, and 5. If the patient fails, we're going to go side lying. Go to your side, sir, please. It's the same testing position as the regular hip extension exercises, as where the lowermost limb is going to be flexed for stabilization. You're stabilizing at the pelvis. You're grabbing here and palpating at the glute max. Please bring your leg back towards me. Okay, relax. That's for a grade 2 with gravity eliminated. Lay on your stomach again, sir, please. Now, for a grade 1, we could palpate for activation. You could ask the patient to squeeze their buttocks. Please squeeze your buttocks, sir, for activation. Thank you, relax. For activation of the glute max for a grade 1. And for grade 0, there will be no contractility due to paralysis. Thank you.